Oh my God, really?
Hello.
Hello. Hi, can you see me? Hi, Sophia, can you see me? Hi,
Hi.
how are you?
Good. How are you?
Good, good. Thank you for joining us. I don't know. Did I lose you again? Boy, I think I lost him again.
Hi, Isa. Yeah, I only see me and you. I just joined early just in case.
Yes. All right. Thank you. And I appreciate that. And I think Corey is trying to log in, and he's our presenter.
Don't you love technology?
I know. Well, I'm
It's
glad that
great.
he's logging in early.
Yeah,
And you know what I think? It's because he's not using, he said he didn't receive, oh my God, I need to rename it. It says my name.
it does. It did say two names.
Corey, can you hear me? Corey, can you hear me? Corey, are you there?
I am. I keep getting kicked out.
I know. Let me see. Let me put your name here.
Oh, it says that I'm you.
Corey, yes.
Should I change it on my end? Maybe that would.
I'm doing that right now.
Oh, okay.
Or you can change it to if I think you can, right?
Let me try.
See, look what I did. I've changed it already.
Rename.
Yeah, good. So I'm having challenges with Zoom because oh, anyway, I guess it's okay, good. All right, now I'm gonna start screen sharing too.
Okay.
Let me just try to do that. Share just to make sure that it does work. So I don't know, Sophia, what do you see?
So
I'm
you're
asking.
good. Keep no, you're good. I see the Contra Costa Health 2024,
All
like
right.
yeah. You
Okay, and then
wanna
when I stop sharing, okay, so then we're going to go through the agenda and then Dr. Lowe will introduce Corey and then Corey, I'm going to stop sharing and then you start sharing.
Okay.
Do you see
I'm gonna
Corey's?
stop sharing
I
mine.
do. I
Okay.
did. He just stopped it, but I did
Would you?
before. Everything was going pretty well.
Okay,
Okay,
well, let
very
me
good.
just get mine set up where I'm sharing because then we can just switch over, right?
Yes.
Okay, perfect.
So there you are. And then I'm going to share, right? Hello. There we go. So now you see the orange screen, correct?
No.
Okay, orange screen now.
Now we do. Now we do.
Okay.
Yes.
All right, and then when I stop, because then we're gonna do the introductions, Dr. Lowe, and then she's gonna introduce Corey, and then I'm gonna stop sharing, and then we
That's
see
good.
Corey's. Yeah.
Yep. Great transition.
Okay, very good. Thank you. And then once you're done, then we just continue on with the next one.
And I am going to jump off because I have to pick my kid up from school. So
Yes.
okay.
All right. Very good. Sophia, have we met in person?
Yeah, we have. Vanessa
We have.
introduced us.
Oh, yes. Okay.
Yeah, and then I was at the barbecue and I asked for the tape. I'll turn
Yes.
my video on. I was just waiting. I didn't want to seem like an eager beaver. It was just more so like the discipline of like making sure everything's on time for me and making sure
Yes.
that, my slides are good and, wanting to cause as less stress to myself as possible.
Yes. That's good. That's good. Yeah. Now I remember you. You had so many people
Yeah,
coming
yeah,
up.
no. Yeah.
But
It,
that's
it was
good.
it was a good event though. Would you agree?
Yes, I think so.
Yeah.
Okay. Maggie is joining. I don't know why it's set up that way. That's so weird. Maggie? Hi. I'm sorry. I don't know why it did. Yeah, it did Teams. It's not supposed to be Teams.
It looked like it was Teams, just
Yeah,
so you know. But Microsoft does that. It'll like
it's not supposed,
automatically put a
we're on
Teams.
Zoom.
I
Yeah, we're
know.
on Zoom. Oh, so you said that it looked like Teams?
Mm-hmm.
Interesting.
They figured it out.
No, because Dr. Lowe was there too.
Yeah.
And it's like, no.
We have the same problem within our organization. It like
I,
automatically makes you have to like pick no Teams when you make it. It's weird.
oh my gosh. No, and I've not had any luck with Zoom. Every time there's always an issue.
Mm.
So, and that's the frustrating part. And I was trying to do away with Zoom, but then the problem is Teams does not have registration capability or registration feature.
Yeah, Teams will break your heart. So Zooms isn't so nice either, though.
And there's Dr. Lowe. Wait, Dr. Lowe, I need to change your name. Okay, because the link.
Oh,
Because
okay.
of the link. So maybe you can change your name. You're not Isa.
I can change my name. No worries.
Yeah, it's just one of those things. If you didn't accept the registration, I think, or register and you didn't click on that link, then
I went through the invite, so that's probably my mistake.
got it. Got it. Not at all.
Great. Isa, do you want to put up the overall agenda before we?
Yes.
Thank you.
Okay, we'll do that. Do you see it, Doc? No, not yet.
No, not
There we
yet.
go. All right. Do you see it now?
No, I see the gender affirming medical care conversation slide deck still.
That is so weird.
Do you want me
Um,
to stop sharing mine? Would that help?
Yes,
help.
I
Okay.
think
So
that'll
much.
help.
Yeah.
There we
stop.
go. That's
I
good.
see. There we go.
There we go.
There we go. All right. Well, to be mindful of everyone's time, this is lunchtime. I want you guys to be able to get your break between clinics and I want you guys to be able to get some food. So let's just get started. Welcome everyone to our 2024 Q4 Contra Costa Health Plan Provider Network Training. For those of you who are joining us for the first time, this is a training that we offer to all of the providers in our network on a quarterly basis. And through this provider network training, we provide updates. We always have a guest speaker to talk about an issue that may be very important for our provider network, or it has been suggested as an item that they'd like us to have a lecture on. We also provide information about resources and programs and services that the Contra Costa Health Plan is currently offering. And we also, do our usual regulatory updates that our state regulators require us to provide our providers on a regular basis. So very excited to have everyone here. And for those of you who don't know me, my name is Irene Lowe. I'm our Chief Medical Officer. I'm going to put my contact information in the chat so that way you guys have it should you need to reach out to me. But I am so thrilled to introduce Corey Bowman, who is the Associate Medical Director at Lifelong Health Center in East Oakland. And he's going to be presenting on gender affirming care, disparities, and creating a welcoming clinic environment.
Corey, I think you're on.
Yeah, thank you. Here, let me share my screen. Make sure I'm doing it right. Can everybody see my screen? Good. All right, so welcome everyone. My name is Corey Bowman. Like I was introduced, so I am a nurse practitioner, and then I'm also the Associate Medical Director of Lifelong, which is an FQHC, but I'm kind of on the other end of the Bay Area. I'm in East Oakland. So I assume you all in Contra Costa are familiar with Lifelong because of our Jenkins Clinic and our residency. I know that some folks kind of rotate through with you guys, so quickly before I get going, I'm hoping that people, if you provide any gender affirming care within Contra Costa, can you just kind of make a note in the chat? I'm just curious. Which is no worries if there isn't anyone. You have to start from ground zero, right? Yay, I provide care. Fabulous. Where are you in Contra Costa?
Hey, this is Trisha. I'm at Pittsburgh Clinic.
Great. Oh, that's good to know. I have patients moving to Pittsburgh a fair amount, so
I'm
nice.
happy to see you.
Oh, awesome. Well, I put my information on this. We'll chat later. So,
Excellent.
great. Okay. So again, my name is Corey Bowman. I use he, him pronouns. Part of the big reasons why I went into medicine in the first place is I am actually trans myself. I was born female and transitioned to male. And kind of from my own kind of bumpy, not so wonderful experiences in healthcare really motivated me to kind of go into medicine and really kind of help provide kind of more culturally competent care. So that's just a little bit about me. This is a huge, huge topic that I usually spend about 2 hours presenting on. So I'm doing a much more abridged version for you guys. At the end of the talk, I'm going to go over some resources a little bit. So if people are interested in kind of getting more education or learning more, there's actually a lot of community-based resources in the Bay Area. So this is just like a little taste of the topic. All right. So I'm going to go over, as Dr. Lowe said, kind of background and health disparities, kind of why it's so important that we have more providers and more diverse areas in the Bay Area, not just in San Francisco, providing gender affirming care. I'm going to talk a little bit about creating a welcoming clinic for the gender diverse community. I heard there's a lot of primary care people on this. Hopefully that's true. Yeah. So I figured a good thing to kind of go over was healthcare maintenance, right? So maybe you're not doing the gender affirming care, right? But you're working with Trish, I think that was your name, right? You're working in the same clinic as them. So maybe you're seeing one of their patients because they're not in the office, right? What do you do? How are you addressing healthcare maintenance? Because we know how important that is. And then lastly, I'm going to go over resources to learn more, right? Because like I said, short little talk and so much more. So I want to kind of offer those resources to people. I find death by PowerPoint to be really awful, right? I know you guys are busy, probably having lunch, trying to eat, get your charts done while you're also listening to me, but please, by all means, add in the chat, interrupt me, talk. It's always much more engaging and interesting if people talk too, besides just listening to me ramble on. So consider adding something. I'll be very happy if you do. Okay, so first things first, background, right? So first and kind of most importantly, there's not a lot of really good data out there even about trans and non-binary folks to begin with, right? So when we talk a lot about health disparities, we look at a pretty big study, right, for the trans community. It was done, the first one was done in 2015, the US Transgender Health Survey, right? But that was done by the National Center for Transgender Equality. It was mostly done online, and it had about, 27,000 participants in it. It was kind of one of the biggest data that we had, right? So part of the issue is that there's a lot we don't know about the trans and non-binary community. So just kind of looking at where this community is, right? And we got some pretty stark data from this. The good news is that they have a new study that they did. Yay, we have some more updated information. Unfortunately, it's not printed and posted yet. They haven't released it. So I have the 2015 data, but it is coming, I promise. When I looked last week, I still didn't see it, but we're going to have kind of more up-to-date data coming in soon. And then the new study was 92,000, right? So pretty exciting. We got a lot more information. And like I said, some pretty stark data coming out of it. So the trans and non-binary community is 2 times more likely to be unemployed, and 90% of the participants reported harassment, discrimination, or mistreatment on the job, right? So a lot of folks facing a lot of stigma when they try to go to work. Poverty, right? So 4 times more likely to have an annual household income of less than 10,000 a year. I don't know how anyone could live anywhere, especially in the Bay Area, on 10,000 a year. So these are definitely patients that will be using the Contra Costa system, right? You guys are a safety net program as well. So these are patients who we're going to see, right? And then the incarceration rate is a lot higher too. So 16% rate, and then a staggering 47% of Black trans people experiencing incarceration at some point in their lives. When you look at statistics about people getting murdered, right? So the general population, there's a 1 in 19,000 chance that that could happen to someone every year. For young adults, unfortunately, it goes up 1 in 12,000. But when we look at young Black trans women, the chance is 1 in 2,600. So pretty stark risk, right? And then what's even worse when you think about it is that experts believe that the rate actually might be higher than 2,600, right? So when we fill out death certificates, we don't necessarily have a way to state that someone is transgender on the death certificate, right? They might be marked as male, even though they identified as female. They were a victim of a crime because they were trans, but they were marked down as male, right? So this rate could be even worse, and we just don't know. That's how little we're kind of collecting information about trans people. Any questions about that? No. Okay. Housing is a really big issue too, right? So 1 in 5 people with this data from 2015, transgender folks experienced homelessness or being unhoused at some point in their lives, right? It's pretty stark too when we talk about gender expression and gender identity with youth. Again, a pretty hard number to catch, right? So they think 20 to 40%, so 40% is pretty high, of unhoused youth in the US identify as LGBTQIA, right? So in the queer trans community. It is a lot of time what leads to the experiences of homelessness or being unhoused is people actually getting rejected by their families of origin. And so when you think are there folks on here that work with the unhoused population in Contra Costa? I'm not sure. Yeah. Yeah, so this is definitely something you see sometimes, right? And so these youth, when they're, kicked out of their home or they don't feel safe in their home, so they run away, right? We start to see a system that's pretty hard to interact with if you identify as transgender or non-binary, right? So gender-based shelters, untrained foster care systems. So, out of the fire out of the frying pan into the fire, right? So going into these systems that really aren't designed to kind of accommodate folks that don't fit into boxes. Um, Also, when we think about health experiences, which the data from 2015, they did a really good job really getting health disparities and information about accessing healthcare, right? We all know this from the work we've done, right? But when you experience bias and marginalization, not surprisingly, you have worse healthcare outcomes, right? We know this happens. We know this happens through a lot of different marginalized groups, right? So 28% of transgender women and 56% of Black transgender women are HIV positive, right? So over 0.5% of transgender women or Black transgender women are living with HIV. So when we look at suicide rates, right? So 41% from this data in 2015 had reported a previous suicide attempt. So when you compare that to 1.6% of Americans, right? So pretty dramatic difference. And then when we also looked at substance misuse, right? 9% in the general population, but seeing 30% in the data. So a group of folks we really want to make sure that we are reaching out to and creating welcoming environments so we can help make sure they're getting their healthcare needs. So they talked a bit too about negative experience in healthcare, right? 50%, so half said that they had a lack of access to healthcare or they had to actually educate their providers, right? So over half were having that experience. 28% experience verbal or physical harassment in a medical setting. So imagine that, trying to just go to urgent care for a UTI and getting teased about, where you got it or, how you should stand during an exam or all those types of things. 19% actually reported denial of care. So this is a national study, right? So, can happen anywhere, but keeping that in mind. And then 33% delayed preventative care due to concern about discrimination. I will say I am guilty of this, right? Was very, very behind on needing to get a pap smear, mostly because I was pretty uncomfortable with doing it and didn't know my providers really well, right? So here I am, a healthcare provider. I finally did it, right? But a healthcare provider delaying my care because I'm too concerned about getting this exam that I'm pretty uncomfortable doing, right? So it's really, really common, and you should expect that people might be behind in stuff like preventative care, just about concerns about interactions with the medical community, especially when we're seeing this kind of experiences when they are interacting in medical systems. Questions or comments about that? No? Okay. And it's election season, so I can't avoid bringing this up. And I know you all are really, really sick of hearing about it, but I don't know if you all have kind of seen since August, the Republican committee, all of their folks have been running a $65 million campaign. So one of the Republicans' closing arguments right now is an anti-trans campaign, right? So these ads, so you can see it's the crazy liberal Kamala's for they, them, Donald Trump's for you is kind of how the ads are run, right? So we, in some ways, are lucky we don't live in a swing state, so we're not seeing these ads quite as much, right? But it's one of the final arguments of Trump's campaign is really pushing an anti-trans agenda, and I think there's a lot to be said when we look at the closing arguments of this this ad campaign, you know, going after folks that are undocumented, the trans community, you know, these are really who they're trying to make their closing arguments about, right? And these ads really focus on transgender youth a lot, and then incarcerated trans folks as well. So if you kind of think about it, those are probably the two most vulnerable trans part of our community, right? Youth who can't stand up for themselves, and then folks who are incarcerated, right? So it's a pretty stark reminder that this is still really out there, right? And this is part of the reason why our the trans community is hesitant to interact with a lot of different things when you turn the TV on and you see ads like this all day. So kind of given that all in mind, and the background of, you know, what's going on with the trans and non-binary community, I wanted to talk a little bit about how we can kind of create a welcoming clinical practice. So I always like to start with this. You know, it's kind of really basic. I have a 10-year-old, right? And it's not that complicated at the end of the day. Um, how we need to treat patients, right? So I always say the golden rule, right? When working with marginalized groups, right? You know, you really want to think about what you do to others and what others would do to you, right? Just keep it simple. It doesn't need to be that hard, right? And a part of that is kind of not making assumptions about our patients and really following a patient's lead, letting them run the show, letting them run how language is used, what words they use to talk about their personal experiences and their bodies, just letting them be in charge. And with this, I would say one of the most important things to really keep in mind is using someone's pronouns, right? And using the correct pronouns. It's really easy for us to be great allies in terms of pronouns. I don't know, can you guys in Contra Costa get your email, the bottom of your email, to add pronouns in it, like he, him, or she, her? Is that something that they kind of let you guys do? Yeah, yeah. It's a great thing to do, right? Add that to your email, right? Add it to your Zoom. It's simple, right? You just go to participants, click on the names, and it says rename, and you can add your pronouns, right? Just seeing that as a trans person really tells me that you're thinking about that, right? It might be like, my pronouns are really obvious. Look at me, you know, there's nothing subtle about this, but it actually reflects to the trans and non-binary community that you notice that that's an important thing to talk about, so you can make a safe space for other folks who maybe don't use the most obvious pronouns, right? That everybody's doing it, so it is not something that needs to be odd for somebody who needs to actually send that marker out, right? So keep it in mind. I assume you guys have probably done a fair amount of trauma-informed care. It's a really exciting part of stuff that's been added to medical education, in my opinion. But you know, what we talked about was don't make assumptions, right? So this includes trauma history, right? You know, we did talk about a lot of pretty stark health disparities, but not everybody experiences those too, right? So we don't need to assume that every trans person that walks in your door has had an awful, awful experience, but you keep it in mind that that is a possibility, right? You want to follow patients' lead as they disclose medical information about themselves. It's also really important to only ask information that is required, right? You know, you don't need to know the sexual practices of a person if they're seeing you for a viral URI, right? So if someone's there for a cold, you don't need to necessarily talk about that, right? And I think an easy way to think about that, and it's really important, I think, with all patients, is to kind of take a minute and step back and be like, how would I feel if someone asked me that question, right? If you think about it in that way, it can really help kind of lead how you start conversations, right? It's also really important to think about confidentiality, disclosure, and outing, right? So it could be that this patient doesn't necessarily, not everyone in their life knows about this. So the clinic that I work at is a pretty tight-knit community. A lot of patients have family members that go to clinics, right? They maybe have family members that work at the clinic. And so it is really, really important to make sure we're respecting someone's confidentiality and not accidentally outing someone, and sharing that information. Setting up the conversation. So this goes along with support staff too, not just providers, right? It takes a little bit of practice, and we're going to talk about that, right? So using gender neutral language, right? So instead of saying this man or this woman, you can try this patient or this person, right? You use someone's name until you know their pronouns, right? When you're getting used to this, what my partner and I did was we actually would practice this at home, right? So we would practice talking about just telling stories at the dinner table, but we would use either where we didn't use pronouns or where we use they, them, right? Because that one I think is the harder one to get used to. So actually going home and taking the time and try to tell a story to a family member where you use they, them for their pronouns instead of she, her. It can really help and get you kind of used to using pronouns in a way that someone might feel more comfortable with. Use caution with using ma'am or sir, right? So I grew up in Virginia, and in Virginia, we call everybody ma'am and sir. That's actually a really important thing. So doesn't mean you can't use ma'am and sir, but you want to make sure someone's comfortable with you using ma'am or sir before you start to use it, right? So not everybody wants words like that. And I'm going to talk a little bit about how to get this information from a patient, right? So it doesn't mean you can't use this language. You just want to make sure someone is comfortable with the language before you use it. And you can always just ask. There's no harm in asking. In fact, most people really like it when you asked, right? So what pronouns do you use? What do you like to be called? Pretty simple. I want to be respectful. I want to use the language that you like. What words do you use? What pronouns do you use? And then I always like to make a good pitch for adding this information in Epic. So you can help your colleagues who come after you and your front desk staff and the medical assistant and the nurse if you add this into the computer system. So adding the SOGI data, right? Making sure what's so nice about Epic is that it really is front facing in terms of, instead of, you guys use Epic, right? Contra Costa? I think. Yeah, good. Okay. The front facing language in the front of it is it really shows a person's preferred name, not necessarily their legal name first. And then it shows pronouns in a really obvious way. So it's a really nice EHR system that is really designed to help you not screw it up, right? So make sure you add this stuff into the computer. So how to ask, right? What pronouns do you use? What is your gender? What sex were you assigned at birth? So this does matter, especially as a healthcare provider, right? You need to know what sex someone was assigned to in order to do the proper screenings on someone. So it is something we need to ask sometimes, right? But one of the ways that you can have this important conversation is to just say something like this, right? In order to provide the best you with the best medical care, I need this information. So what sex were you assigned as birth, right? Making sure you explain why you're asking these sort of personal questions, right? But then asking them too. We can't not ask them. We just need to do it in a respectful manner, right? One important thing to know is that if you make a mistake, you just apologize politely and move on. So again, I was raised Catholic. If you say, I'm sorry, oh my God, I made a mistake, blah, 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 you go on and on, you're going to make me feel guilty for you feeling bad, right? I've been trained to do that. And so just saying sorry once and moving on is much more helpful, right? And it doesn't end up putting the onus on the person who has been told the wrong name, right? To making them feeling bad, right? Apologizing over and over again, right? So apologize once and move on. Everybody makes mistakes, right? We all know that. Other tips for creating a welcoming clinic environment, right? So identify transgender allies in your clinic and bring questions you have to them, right? So we have someone out in Pittsburgh that is doing trans care. That might be a great colleague to reach out to if you had any questions, right? You can reach out to me, right? So the idea of this is that we ask our questions to colleagues that know this stuff, right? Not necessarily to the patients. So the patients are there to get the care they need, and our colleagues are there, and trainings like this are there to kind of help us with getting better at this stuff. Hang trans inclusive signage in patient areas. Super, super important, right? You never know who you're going to reach out to. I love to tell this story. So I hang a lot of prep stuff on my wall, right? So just, flyers, I have a magazine in the room, and I can't tell you how many grandmothers and aunties have asked me about prep. And they've said, my grandson might want this medication, actually. I think this might be good for my grandson. And I say, wonderful. Have your grandson come and see me, right? So you don't actually know who you reach out to when you put this stuff on the wall. It isn't just the patients themselves, it's the family of these patients, right? And it creates a safe space for the family and the loved ones and the allies to ask questions about it too, right? So keep it in mind. Hanging up a silly sign actually really makes a big difference. Really important to hire trans people, right? It will make a big difference if the trans folks are part of the staff of places, right? Um, Provide gender neutral and gender non-specific bathrooms and then shelter rooms too, right? So really, really a simple thing. You have a single stall bathroom anyways. I like to tell people we all use gender neutral bathrooms in our homes, don't we, right? Men, women, and everybody in between uses the bathroom. So we can do that too in a public space, right? So single stall, make it a gender neutral bathroom. Provide staff ride trainings and repeat them because we all have pretty high staff turnover in the places that we work. We know that, community health is tough. And then create an organizational culture that supports using names and pronouns, right? So putting the rainbow flag on your sticker. I notice that every time I go to the doctor's office, right? And then include pronouns in your email signatures like we talked about, right? Questions about that? So those are all pretty low-hanging fruit things too, right? Nothing that we have to do too much work around that we can really do. Start by hanging something up in the wall, right? Makes a big difference. So I'm going to switch over to healthcare maintenance for the gender diverse community. So just to kind of remind you the data that I talked about way in the beginning of this, right? 50% of study participants reported delaying preventative care, right? So these are just some sort of tips and things to think about when you're thinking about healthcare maintenance for this community. This was an interesting study that I found. It was called Aging with Pride. So a longitudinal study at the University of Washington that was designed to kind of better understand aging in the LGBTQI community. Just so you know, I'm not trying to make anybody feel old in this, right? So they also included midlife, right? So people in their 50s were included in this study. And what's really nice about it is they had not the worst. They had 174 transgender and non-binary people in this study, which is not a bad N actually when you're looking at some data. So I'm going to go through this, but I kind of want to keep in mind when we're talking about this that the L and the G and the B, so lesbian, gay, bisexual, and queer identified folks are also not getting healthcare maintenance screens at the same rate that cis and heterosexual people are, right? So I'm comparing a group here that also has a hard time getting their healthcare maintenance needs. So just kind of keep that in mind, right? But if you look at the differences, right? So these are folks that are up to date on their healthcare maintenance screening. So this is the cisgendered lesbian, gay, bisexual population. 89% had done their mammograms, whereas the trans community, 38% were up to date on it. Pap smear is equally not so great, 82%, 26. When we look at FITs and colonoscopy, right? Pretty equal on the FIT, 19 and 20%. But then colonoscopy not as great, right? 68% and 83. And then HIV screening, preventative testing, right, was pretty close too, with 20 and 22%. So one of the things I think you can really get out of this data is you should prioritize things that are less invasive, right? So if someone's really nervous and still getting to know you and not sure if they trust you yet, just order a FIT or a Cologuard, right? Maybe don't jump to the colonoscopy or the mammogram right off the bat, right? Pick something that's kind of, everybody has a butthole, as I say, right? So pick something that is a little less invasive in HIV testing. I also recommend that you should know your specialists, right? So I do this when I have to refer somebody, like they had an irregular pap smear and they're going to need a colposcopy, right? Or someone had a positive FIT and they need a colonoscopy. I'll put the referral in and then I'll just call over to the GI doc and just kind of give them a little bit of a heads up that I'm sending this trans patient over and they're a little nervous about the exam, right? It really makes a big difference. Just kind of taking that extra 5 or 10 minutes just to kind of give someone a heads up. And then also knowing the specialists within your community that are trans friendly too, right? So you can I'll often ask patients, like, if you don't mind, when you come back, just give me a little feedback on how your experience was with that GI doctor that you saw, right? And it just makes a world of difference for folks. So it's really important that we know surgical and hormone use history when we think about healthcare maintenance, right? So PSA testing, how useful is it anyways, right? That's a whole nother presentation I'm not doing today, right? Just one important thing to keep in mind is when someone has a vaginoplasty or bottom surgery, right? So they have a vagina now, they don't actually take out the prostate. So if you have someone who's a higher risk for prostate cancer, it's something you need to kind of keep in mind, right? Mammograms. So trans feminine folks will develop breast tissue. Maybe they get a breast augmentation, right? But the tissue is often denser on mammograms. So we're not 100% sure how helpful they actually are. We don't know a lot yet. We're still doing more longitudinal research, so that's decent. But for now, what they're recommending is that you should start breast cancer screening 5 years after starting hormone treatment, right? So once they start hormones at 55, then you would start it at 60, right? They started hormones at 22, you would start it at 45, right? Or 40. Now they're saying 40, right? So, it's when you've been on hormones for 5 years. It's a little trickier with transmasculine folks. So people get top surgery, right? But that is not the same as a mastectomy. They do leave some breast tissue in, right? It's a plastic surgery. So it's a little trickier to kind of know the risk. We do a lot of informed consent conversations around this. I recommend considering BRCA testing if this is a person that would qualify for it, right? Because that will help with the decision. You can also order ultrasounds and MRIs. Don't forget about other screenings too, right? Of course. Bone health and osteoporosis. Again, this is a trickier topic, right? There's a lack of consensus really about what we do with cis folks, right? And it's even worse with the transgender and the non-binary community, right? Things to kind of keep in mind, and this will happen if we think about health disparities. People don't always have access to good quality. Maybe they were buying hormones on the streets. They were going down to Mexico and getting treatment and kind of coming back, right? So if they had some sort of bottom surgery and weren't on hormones, then you would want to consider that, right? Before the age of 45. If they took a blocker, so something like spironolactone or Lupron without using estrogen, you want to consider that. And then medicine like Lupron, being on that without estrogen. UCSF's guidelines recommend trans people, regardless of sex, sign, and birth, should begin osteoporosis screening at age 65. This is what I do. I've actually sent this recommendation when I've had fights with Medicare and it's gone through. There's not any kind of better guidance than that, but I think it will happen in the next 10 to 15 years. So keep going to trainings. Last but not least, let's go over resources a little bit, okay? So prescriber guidelines. A lot of folks know UCSF transgender care. This is a link. So these are guidelines that you can follow when you're prescribing hormones. They are about to update it. They're waiting on the Endocrine Society, which is the last one, to update. When the Endocrine Society updates theirs, the UCSF is going to update theirs as well, right? So it's still up online, but they're all about to be updated. The Endocrine Society is very heady. You can sit there and wax on for hours about it. The UCSF is a little bit more kind of, you're a fast moving clinic. You just got to look at a resource really quickly and keep moving. That's a great site for that. People are a little less familiar with Transline. I love their guidelines. So this is a collaboration project between a bunch of national LGBT community clinics. So they're really kind of based a lot like the populations that we're working with. They have wonderful guidelines, very easy to read. I just have them posted on the wall in my clinic and I can take a look at it. So good resources. Extra reading. So the same group that put out all this data saw that there was a lot of work we needed to do about working with non-binary folks, right? This is a lovely little short reading about non-binary folks and kind of how to provide the best medical care for this community, how to really use our they, them pronouns or no pronouns correctly. So take a look, read that. And then consultations, right? So Transline also has an e-consultation on it. It's a group of experts. I know a bunch of people working on it. They're wonderful. You send them an email question and then they'll respond to you within 2 business days. This is a link to that. And then you can always email me if you have local questions. Just tell me who you are beforehand. And I'm happy to answer your questions. I'm just a county over. I'm not too far away. So. And then this is going to be a plug for something I do, but I think it's really helpful. So the AIDS Education Network of the Pacific, right? There's an 8-week series over Zoom. It's in February and March of 2025. It's on Fridays over Zoom, 8 to 9:30. It's like 10 Fridays. You get to talk with a bunch of surgical surgeons come on. They have peds expertise, behavioral health, really in detail, primary care. This is a really old flyer because I don't have a new flyer. They haven't made one for 2025, but the contact person is the same. And we are actually looking for Contra Costa people. We have a lot of Alameda County folks coming to these trainings, but less Contra Costa. So if you are interested in applying and kind of learning more information, please do. The contact, like I said, it's an old flyer link here, but the contact information is correct. So you can just reach out to that person and go ahead and apply. I think the applications start in December. You can learn a lot more details about trans and non-binary care. And that's it.
Thank you so much, Corey. That was fantastic.
You're welcome.
You know, I find myself unfortunately tripping over pronouns often, and I really appreciated your statement, you know, apologize and move on.
Exactly.
So that was really,
Right.
you just need to hear it.
Yes.
So another question that I have for you is, you know, oftentimes when I've been taking care of transgender patients, you know, to your point earlier about how there's other medical issues that they have as well, I found, you know, mental health to be something a little bit difficult to deal with, and it's really hard to encourage them to seek that help. Do you have advice on that?
Yeah, you know, I think one of the things that can really help, and it looks like there was a lot of good comments. I'm sorry I was rambling on. But finding someone within your network that is knowledgeable of the trans and non-binary community, because honestly, I think that's a lot of the hesitancy people have is just not having culturally competent folks, right? And really nervousness that the entire conversations are going to be about them being trans instead of about what they're going through in their lives, right? So that's where I would put the emphasis on is really trying to find someone within your network that's culturally competent, right?
Thank you. Any other questions for Corey?
Look, and there's lots of people there making comments of folks that they can happy to help, right? So there's good people within your network, right? And they're going to know the ins and outs of Contra Costa in a way that I won't, right? So if you're looking for the therapist and you're like, where the heck do I go? They can really help with that, right? So Trisha, thanks for putting that information out there. Appreciate it.
Thank you so much, Corey. Really
You're welcome.
appreciate it.
All right, I'm going to jump off because I have to pick up my kid from early release. But it's nice to meet everybody.
Thank you again.
Okay, you're welcome. Bye.
Aisa, do you mind sharing the agenda again, or our presentation slide deck? Great. So, just to pivot off that wonderful presentation, Allison Liu, our quality manager in our health equity office here at CCHP, wanted to provide everyone with some additional gender affirming care resources. So I'll turn it over to Allison.
Thank you, Dr. Lowe. Thank you, Isa. So most of you probably already know at RMC, our health centers network, we also have a gender clinic. I see Dr. Trisha is here on the call. So this is a monthly specialty outpatient clinic for trans and non-binary patients. All the patients must be 18 years old or and older and have CCHP Medi-Cal to be seen at our CCH Gender Clinics. And I have also included our schedule from Gender Clinic here. It's mostly on Thursday and Friday, but we have 3 physicians seeing patients in 3 different health centers: West County Health Centers, Martinez Health Centers, and then Pittsburgh Health Centers. Next slide, please. So for the services we offer in our gender clinic, it includes medication and hormone management, and then referral to mental health care, referrals for procedures at contracted clinics. And also we have a case manager there to provide case management and connection to other community resources. So if providers would like to place a referral, that could be done at our CC Link or Epic using the internal referral button. For referral for LGBTQ trans mental health professional, use referral code 640. For surgery letter writer, use referral code 299. And patients can always self-referral by calling the health regional medical health center appointment unit and 1-800-495-8885, and then requesting an appointment and the gender clinic.
Allison, just wanted to
Yes.
let those who are not affiliated with Contra Costa Health, the integrated delivery system. These are orders specifically for those internal to Contra Costa Regional Medical Center and the health centers. So for external referrals going into RMC, I think it's at the discretion of RMC, their capacity and their availability. I would defer to them to let us know if they're able to accept external referrals.
Thank you, Dr. Lowe. Okay, next slide, please. So one of the reasons we would like to provide some more resources is because we're having a new services starting this past September. It's a support and education group for LGBTQ plus youth and their families. And this is a support group for youth ages between 13 to 18 and their guardians. So LGBTQ plus teens and their guardians can attend together or separately to this support group. It is done on a Zoom, and it's open on every Wednesday and 4 p.m. It'll be mainly hosted by our Contra Costa Health Behavioral Health Department. So there will be some LGBTQ plus advocates, allies, and mental health professionals on these supporting groups. So usually on every week, there will be when it's on the Zoom, they will cover a general topic, and then it will be split into 2 groups for discussion, one for teams and one for family or guardians. So the only eligible requirement is the teams must be a CCHP Medi-Cal members, and the parents and the teams can join separately or together. So the teams will be enrolled in behavioral health so that both teams and their family can join the support group. If you would like to refer any patients or any teams that you know, you can call 925-332-6087 to sign up and registration for the support group. And there's some overview of the topics that's on the screen. That's just a general idea of what they're going to discuss during the support group. You can go to the next slide, please. So these are the flyers they have. I believe ISA can also send out the flyers to folks. There's one flyer for the family and one flyer for the teams. They're both welcome to these groups. Do we have any questions?
Allison, I just have a quick question as you were going over these resources and the requirement that they're enrolled in mental health or behavioral health services. Is that, can they self-refer and then be enrolled so that they can participate?
So they don't need to be enrolled at the moment, but after they referral and call that number and register, they will help them enroll into behavioral health. They don't need to be active with behavioral health right now.
Great, thank you.
Thank you for the question.
All right, thank you so much, Allison. For the sake of time, we'll move on to the next topic. I'd like to introduce Dr. Sarah Levin, one of our medical directors here at Contra Costa Health Plan, and she's going to be talking about our Baby Steps program.
Good afternoon. And I know we're just got 15 minutes left, so I will go through this. We formerly called this Baby Watch. We've renamed it to the Baby Steps program. And what this really is I'm going to present to you from our case management department, but there are components within this that don't require enrollment in case management and are independent benefits. So I'll try and clarify that as I go through that. But essentially, we've stood up a particular line of business in our case management department to support pregnant and postpartum members. And eligible members could be pregnant anytime in the last 12 months. And it also includes services for members who do not carry their pregnancies to term, have a miscarriage, or have elected terminated pregnancies. And really, the program is designed to provide some comprehensive care coordination and support to our members who are trying to navigate both their health care and their resources in the community through the process of becoming pregnant and whatever becomes of that pregnancy, with a focus on really supporting our members through the post-pregnancy period as well. As I said, it can be support for up to 12 months following. Most of our referrals really do tend to be more linkages and coordination, and sometimes our case manager, who's dedicated to this program, Maria Rosas, will do an initial case management episode with members. They've got what they need. She may not hear from them for months, but then they may re-engage her at a later stage in the pregnancy or postpartum. So it's a little bit more fluid than some of our comprehensive case management, which is tends to be more of sort of 6-month episodes that are continuous. And so there's a lot of different resources, including scheduling and managing healthcare appointments, arranging transportation, so connecting to the other benefits that are available to other members of CCRMC, but acknowledging particularly that people in their in a pregnancy episode may have needs that they haven't had before and are for the first time accessing them. And the idea is really that this tailored approach to this certain demographic and population will streamline access to essential resources and promote better health outcomes for both the mothers and their babies' health and well-being. So how do we refer? It's the same as any case management referral, and there's a checkbox for the Baby Steps program via the portal. Or you can refer by calling case management department, no different than from our other programs. Next slide, please. What our goal is that once we receive referrals in our case management department, that within 2 weeks, they will complete an initial assessment and create a care plan together with the care coordination goals and tasks to be addressed monthly. And these are some of the linkages and services that are included in the care plans. I just want to highlight number 3 and number 4, which are doula services. So this is one avenue through which we're trying to educate our members and make them aware of this new benefit of doula services. We have been expanding our doula providers and continue to work towards that. Again, this is a benefit that's available to anybody who is experiencing pregnancy, a member who's experiencing pregnancy, regardless of how that pregnancy is ends in birth, ends in termination, ends in miscarriage. There are those services available in up to 12 months postpartum. There is a standing order. Previously, when we rolled out this benefit, the doula benefit, it did require a physician order. There has since been a standing order issued by the Department of Healthcare Services such that there does not require a separate physician order, so people can self-refer for services as well. And we have been expanding our outreach efforts around that, and we'll be distributing flyers. We've updated our webpage, flyers to provider offices. So if you are a provider in our network who provides perinatal services and or reproductive health or abortion care services, we hope to be reaching out to you soon and providing some materials to try and make more prominent in your office these benefits that are available to you, our members and your patients. Next slide, please. So again, these are just some of the community resources, hotlines, support groups, and programs that are often part of the care plans that our case managers in our Baby Steps program are helping members to connect to. And next slide. And this is just a slide talking to the doula benefit, which I talked to previously. We did host on September 6th a workshop that brought together representatives from many of our programs in Contra Costa Health that provide services to pregnant and birthing mothers, with a focus on those who are most disproportionately affected by health inequities, such as our Black African American members and residents who are going through pregnancy with increased poor maternal health outcomes, as well as preterm birth. So the programs that are specifically focused on supporting them to have healthy pregnancies and reduce those disparities. The other groups of focus with disproportionately high poor health outcomes with maternal health include our Alaskan Native and American Indian members, and Pacific Islander are the other groups that are eligible for certain additional benefits and services, such as the enhanced care management population of focus. This workshop that we hosted was a wonderful kickoff with, I think we were able to engage people from our Black Infant Health Program, from our perinatal equity initiative, and our other maternal child health programs that are working in this space throughout Contra Costa Health, and hoping to continue to build and grow those partnerships to better raise awareness regarding these doula benefit and providers and the expanding doula network. Next slide, that may be it. Okay, yeah. So again, here are some links for our updated webpage, which does list all our ongoing contracted doula providers and how to access them and make referrals. And sort of an overview. We have been part of this initiative in terms of expanding the doula benefit, is bringing increased awareness around what doulas are, how they can support you, how they can help you. And we will be looking to, as we grow that, looking to our providers to better provide that type of information and support and encouragement to their patients that they're seeing, so that our members can have the most supported pregnancy outcomes that's possible to ensure the optimal health. So please don't hesitate to outreach to myself and or our case management, and we do have a project manager now, Miranda Pena, in our health education and quality department, who is helping to support this effort. So more to come.
Thank you so much, Dr. Levin. Any questions for Dr. Levin? All right, well, hearing none, we'll turn over to the next slide. All right, so Sophia Rosales, our Senior Health Education Specialist here at Contra Costa Health Plan, is going to provide some information on health education. Turn it over to you, Sophia.
Thank you, Dr. Lowe. Hi, everyone. I'm honored to be here today. Just a brief health education update. Next slide, please. So just an overview regarding some of our scope within the health education program and some of our offerings. Within the health education program, we offer a new website, and that I'll be talking about in the next slide as well. We launched a new website. We partnered with Crames, and within that website, we have medically accurate, a lot of articles, self-management tools, interactive videos for our members that are able to access that, and they're able to also see things that are in low literacy and just different types of health topics that might interest them. And like I mentioned before, things that they can interact within themselves. We got a lot of feedback regarding our members wanting more videos, and thankfully that website does have a lot of interactive videos that help engage our members in learning of topics that capture their interests. We also produce a member newsletter 3 times a year, and within that newsletter, we have different requirements of topics that we have to cover, but we also like to hear from our FHQs and our members about maybe some topics of interest that they'd like to see highlighted on the member newsletter. We offer resource guides. We also develop different materials that are developed and are offered in English, Spanish, and Chinese as well. We also host different classes and events, and we're definitely trying to establish more of a strong CCHP presence out in the community. We just did a couple of tabling events last month and are looking forward to do more. The health education team is also available for health education one-on-one appointments if a member desires and is interested in something like that. And we also offer group consultations and much more offerings if they're interested. Next slide, please. Like I mentioned, a really cool update that we had this fall, we launched our brand new health education website, which I put a little picture up on there. We really enjoy it. It's definitely something that had been in the making for a while, and it's developed by Crames, and all the content is medically accurate and extensively reviewed. It's also offered in Spanish. We're currently in the process of getting those materials translated in Chinese as well, but we still do have former content that we had before still listed in Chinese, and other resources available for members as well. Oh, thank you, Isa. And then lastly, like I mentioned, we like to make sure that anything we offer for our members is written at a 6th grade reading level, just to make sure that we're offering inclusive health literacy for our members that might not have English as a first language. I provided the QR code and the website, so check it out if you have a moment. Next slide. And lastly, that's just me and the team at Lifelong at a tabling event. If you happen to just, are interested in us coming to your clinic, and we provide educational materials, resources, we'd be happy to host any classes, resource fairs, or just provide anything we can to make sure, like I mentioned, that we establish a strong CCHP presence and that we also carry out health education outside of these 4 walls. I listed the health education email. If you have any questions or any resources, I'd be happy to provide them to you. And yeah, thank you all for your time. Thank you, Dr. Lowe.
Thank you, Sophia. All right, we'll head to the next topic. Happy to have Laura Salcedo, our claims manager, here on the call to talk about submitting claims. Laura, I'll turn it over to you.
You're on mute.
Oh, sorry, I was muted. My apologies. Thank you, Dr. Lowe. So again, Laura Salcedo with the claims department here at CCHP. I did want to go over the forms of which you could submit your claims. So a claim submission timeframe for the Contra Costa Health Plan is 180 days from the date of service. So we want to ensure that we're submitting the claims in a timely fashion to ensure that they are paid and not denied for timely filing. We do have 3 forms of submission, one of them being our electronic clearinghouse, EDI. We do utilize Availity. You can register directly with Availity, or I also did provide the hyperlink here to the slide, and our payer ID is CCHP. We also have our CCHP CC-Link provider portal, where you could enter your claims directly into the portal, which it's a little bit faster to get to our claims department. You can find the enrollment form also by following the link below, directly on this slide. Once you have your form completed, please submit it to the CCHP portal support at cchealth.org to have that expedited and have you set up in our CC-Link provider portal. Our last method of submission is paper claim submission. You can mail your completed UB4 claim forms along with all required supporting documents to CCHP Claims Department to our PO Box number 5122 Lake Forest, California 92609. The paper form is a little bit lower, so we would like to emphasize on using either our EDI or our CC-Link provider portal. Thank you all.
Thank you, Laura.
Of course.
All right, we'll head to the next slide, please. Oh, it's me. All right, well, wonderful. So we wanted to end the talk today with some CMO updates. So some of the things that I'll be talking about and hopefully getting you guys out here early, wanted to share our dental coverage disclosure, what's coming soon, some initial findings from our Department of Healthcare Services audit, and to give you guys more information about our CPT code search tool. Next slide. So our dental coverage disclosure. So in accordance with Assembly Bill 952, which was passed by the state legislature, this Assembly Bill covers dental coverage disclosures. So as a result, CCHP will be ensuring that all providers in our network are aware of the dental benefit design for all of our lines of business. This Assembly Bill 952 requires that our plan, as well as other healthcare service plans, make sure that we disclose whether an enrollee's or insured's dental coverage is either state regulated through a provider portal if available or otherwise upon request and we want to do this on or after January 2025. This bill also requires a plan to include the statement state regulated if the enrollee's or insured's dental coverage is subject to regulation by the DMHC on an electronic or physical identification card or both if available for contracts covering dental service issued on or after January 1st, 2025. So more information to come, but just wanted to provide everyone with this upcoming information. Next slide. So coming soon, just wanted to share with everyone, if you haven't heard already, that on January 1st, 2025, current and former foster youth who had been part of Medi-Cal fee-for-service will be transitioning into managed Medi-Cal in single plan counties. So since Contra Costa is a single plan county with Contra Costa Health Plan being the main Medi-Cal health plan in the county, we will be absorbing current and former foster youth into our membership. And, beholden to that is really trying to minimize disruption to any care or services that they are receiving. So our team will be working very diligently to ensure that existing authorizations persist through the transition and that we promptly manage any authorization requests for continuity of care. Our team will also be undergoing our NCQA review in 2025. They will be specifically looking at quality and health equity. And then our plan will also become a dual eligible special needs plan in January 2026. I also wanted to highlight that Contra Costa Health Plan was provided 4.5 stars by the National Committee for Quality Assurance, NCQA. That is a fantastic score. Very few people have 5 stars, and so that means that we are among the top health plans in the country in terms of quality of patient care. And I have to say that this is a job not solely done alone by CCHP. We could not have been able to earn such a high ranking without the diligent and comprehensive and quality healthcare that you, our provider network, provide to our members. So kudos to all, especially our provider network. So thank you so much for that. Next slide. So just wanted to share with everyone some initial findings from our DHCS audit. Next slide. Oh, sorry, go back. So we recently completed our 2024 Department of Healthcare Services audit in August, and overall our team did very, very well. We were able to highlight all of our accomplishments and hard work and transformations that we've been doing over the past year. And we did have some initial concerns, but less than we've ever had in the past. And so we're very excited to hit the ground running to resolve these issues and continuing to make sure that we are providing our members with access to care. Next slide. So very excited to share with everyone that CCHP and our IT team have been working very, very diligently on putting together a web-based CPT code search tool. Many of you may be familiar with our authorization matrix. So this tool will be replacing the matrix with a CPT code-based search tool. So this will hopefully launch before the end of the year. You will find out more information as we get closer and closer to a go live date. But essentially, this is a web-based tool where you can enter a CPT code or keywords to determine if a CPT code requires prior authorization or not based on line of business. So here at CCHP, we have 2 main lines of business, our commercial as well as our Medi-Cal. And we run both lines of business a little bit differently in terms of what requires prior authorization and what codes are accepted. So this will, I think, will be a really great resource for you as well as your teams if you're not the primary people placing the prior authorization requests. So we're really excited that we're getting near the end and that we'll be able to go live soon. So just wanted to share that information with everyone. Next slide. Okay, so that's all I had for everyone today. Just wanted to find out if there were any questions from the group. All right, well, hearing none, thank you so much for joining our provider training today. And of course, if there's any feedback or any suggestions for future presentations, please don't hesitate to reach out. And also, by no means should you not reach out between provider network trainings. If you have any questions or concerns, please don't hesitate to reach out to our teams. Have a wonderful day.
Thank you. Thank you.